Alright, welcome to the Clinical AI Rounds. This is the sixth episode, and today we're discussing overfitting when AI learns too well. So let's suppose that you have this following case, like a data scientist comes excited about their model for brain tumor detection with an accuracy of 99%, and you ask, okay, how did it do on external data? This is a very common scenario, and then the developer or the data scientist pose and tell you, okay, it hasn't been tested yet. So you try it on external data that it never seen before, on real world data, and it does not perform as intended. Probably 99% accuracy is a little bit exaggerated, but just like to give you an overview or like to drive a message home. So overfitting. Very common term to hear when discussing AI models. What is it? Overfitting happens when the model learns the training data too well that it does not know how to respond to new data. And we're going to see an example. It happens because we have two reasons. The machine learning model is way too complex, so it just can, for example, a polynomial that can really goes and try to find the exact patterns that are in the data already. So when you expose it to other data that is a little bit different the pattern, then it does not really perform well. So it memorizes very detailed patterns in the training data that do not generalize well to new data, or the training data size is too small for the model complexity and or contains large amounts of irrelevant information. So when your data is too small, then it learns on that data, but it has not seen enough data that captures the whole pattern underlying the reality or real world presentation of whatever you're trying to classify on or you're using your AI model on. So you can prevent overfitting by either then reducing the model complexity. So it's like a trade-off. If you have a model that is too complex, then it learns the data too well. But if the model is very simple, it does not learn the data too well. It can perform so it has let's say 60% accuracy, but this accuracy will remain when you expose it to other data. So it does not drop, but it's already low. But if it's too complex, then the accuracy might be too high, but then when you give it other data, like new data, it just drops. And the other way to deal with overfitting is improving your training data set. So either you increase the data set or you improve the quality of the data set. And very good resource to read more about it is from the MATLAB or blog or mathworks.com. I used it as a reference, so you can refer to that for more information. So you have overfitting, but then you have underfitting. So underfitting is that does not learn the patterns that you're trying to capture. So it doesn't perform well on the data that you have, and it will not generalize on a new data set. And you could look at them as two sides of the same coin. So overfitting and underfitting can be present in both classification and regression models. So you have either or, and they could happen in classification binary or regression models, which is numeric. Let's see an example again from the MathWorks blog. So these are classification tasks, and this is for regression numeric. Let's say like here pathological in blue and normal in orange. So if you have very you find a model that captures exactly what's going on, separates them very well on the data set, then this is overfitting. So when you expose it to new data, it will not perform well. So this is a little bit better. It missed a couple of points, but then you might use it for other data set or that it has never seen before, and the accuracy will not drop. So this is the right fit. And if this is a line basically did not really learn, it's gonna perform bad on the dataset that you have and on the new dataset. The same goes for numeric values for prediction, for example, regression. This captures almost all the data points. That's the shape that you have, and this is not a good fit at all. How could you tell? For example, there are methods like least square method that tells you how far is the points from the line and then gives you a number of goodness of fit. So clinically, if you have something with high accuracy, a model with high accuracy, this could hide poor generalization. So to diagnose overfitting, when someone comes up with a model and then you need to ask them where training, validation, and test sets truly separate. Usually you have a data set, then you separate it, for example, for training, validation, and you leave portion of it, like 10% for testing. So it's not for training, not for validation. The model will have never seen this dataset during the training or the validation. And this would represent kind of like a separate external data set. So that is a good practice. So if this was not done, then you might reasonably question the quality of the model or the output. And then you could ask, did the test data come from different patients or sites? Helps you like kind of assess generalizability. And then was performance confirmed prospectively or externally? Again, over time, validation, and externally it's like from different sites or different institutes with different, for example, scanners and so on. So when this does not happen, like if it was not tested, externally validated, was not really properly trained on a test set that was never seen before, you might have impressive numbers, but then those are clinically useless results. So that is pretty much it for today in this clinical round. At Clinical AI Academy, we aim to improve AI literacy in healthcare by providing high quality, open source educational content focused on AI, neuroscience, medicine, psychology, philosophy, linguistics, art, and more. Open to everyone. Everyone is more than welcome to join us from all professional backgrounds, regardless of your level of expertise and level of knowledge. There's the website, clinical.ai.academy. And you can join the newsletter to stay up to date, the clinicalaiacademy.substack.com. I hope to see you in the next one. Thank you.